The tragic death of 2 patients at a Humboldt healthcare facility over the Christmas season due to carbon monoxide poisoning was a wake-up call to health regions and the province as a whole. Up until this point in time, most healthcare facilities across Saskatchewan did not have carbon monoxide detectors in their facilities. The province has since advised all healthcare regions to assess their facilities and file reports outlining the status of their region and the number of plug-in-style carbon monoxide detectors required across the board, and the details of also installing hardwired systems. Here in the Southwest, the Cypress Health region has already submitted a report to the Ministry of Health with the following notations.
So the short-term plan at this point would be to look at the residential type carbon monoxide detectors that plug into the wall and have a battery backup, and they're good for about 7 years. So that would be sort of our short-term plan. Now, in order to ensure that we've got them in all of the right locations throughout our region, we're looking at actually about 220 units that would need to be purchased and installed, and then monitored and listened for. The longer-term plan would to look at actually doing the hardwiring of a system into our fire system that would also alert then not only within the building but potentially to an outside organization that would monitor that as well.
Vashon further outlines the approximate cost for the carbon monoxide detection upgrades to the health region.
To do the permanent solution, which is something that we would be looking at, is probably around about $65,000 to hardwire those into all of our facilities. The temporary solution isn't quite as expensive, but I think we could find some pretty significant savings if we were able to purchase as a province at this point.
Overall costs, which the province says it will assist health regions in some capacity.
The short-term plan, there's not a lot of cost attached to that. The long-term plan may have cost. And the ministry will provide funding if it's needed.
Depending on the supply and demand, plug-in-style carbon monoxide detectors will likely begin being installed across the Cypress Health region in the next several weeks, with hardwired systems installed sometime thereafter.